Welcome to our video workshop titled Learn Unique Strategies for a Unique You. In this video, we will be addressing different adult learning styles and strategies for teaching adult learners based on decades of research by Drs. Peter Honey and Alan Mumford. There are two parts to this lecture. In part 1, we will be briefly discussing the history behind the Honey and Mumford learning styles, and then we will take a brief assessment ourselves to see what type of learner we are. After the assessment, we will reconvene for part 2 of the lecture where we discuss strategies for the different learning styles as classified by Drs. Honey and Mumford. It is meant to be fun, so don't take yourselves too seriously and try and enjoy the process.
There are many different types of learning styles, and we likely know how we learn best without having to take /assessment. But we most likely have no idea how our students themselves learn and pick up material. Doctors Peter Honey and Alan Mumford studied adult learning styles based on the work of Kolb and have identified that adult learning can be broken down into 4 categories. We will get into this a little bit more later, but regardless of whether you are taking your concepts from Kolb or Honey and Mumford, one thing is clear: the common goal is effective learning. Now, who doesn't want that? Everyone wants their learning to be effective, otherwise it would be a waste of time and effort. So what makes learning effective? Well, according to Dr. Honey, there are 3 points that make the learning experience worthwhile. Number 1, the learning sticks. Number 2, the learning gets used appropriately and is useful. Number 3, when put to use, it makes a difference for the better. And in a perfect world, your audience would be able and willing to learn. Therefore, to be the best preceptor, it's not enough to be a subject matter expert alone. We learn through experience, and those experiences give us knowledge and meaning. These experiences become a difference between a novice and an expert. As educators, we need to at least understand how adults learn and consider that in our efforts of teaching. Teaching takes practice. Give yourself some room to be flexible and see what works for you. We can define how our students best learn by making connections early on. People have preferences on learning styles. Not everyone is an auditory, a visual, or a spoken learner. Peter Honey and Alan Mumford knew that in their research and identified 4 distinct learning preferences. They classified them as the activist, the theorist, the pragmatist, and the reflector. In an ideal world, we would seek out opportunities to teach using the learning style most chosen by our audiences. This, of course, is not always practical in what we are doing, so if it doesn't work for you, don't sweat it. As adult learners, we are also capable and adaptable and can compensate for our own deficits.
In this next slide, I would like to encourage you to take a break and do this exercise before you come back to part 2. Here is a link to the Honey and Mumford Adult Learning Assessment. Take this test. Allow yourself 10 to 15 minutes to complete it. Score it. It is easy to do. Just tally up the scores, and the highest score will be your preferred learning preference. Then come back and learn about what that means. It's a fun exercise. I will see you in a few minutes.
Welcome back to Part 2, Learn Unique Strategies for a Unique You. We will be reviewing our results from our own Honey and Mumford assessments and addressing the 4 distinct types of learning styles. If you have not yet taken this assessment from the last slide, please pause this video and complete that before you move on. In this part, we will be discussing what type of learner you are, maybe, and what does it actually mean.
Honey and Mumford have classified 4 types of adult learners. There is the activist, the theorist, the pragmatist, and the reflector. You may be confused about your own test results. And maybe you are almost as much a reflector as you are a theorist or some other combination. That's okay. We can be fluid and move between learning styles or be as much of one as we are the other. Learning is a skill that calls for continuous improvement. Don't give up and stop trying to learn in other modalities. We can adapt for that matter, so can our students. Through studies conducted in the UK on adult learners, surgeons, most interestingly enough, are often categorized as activists or pragmatists. Trainees often fell into the category of theorists or reflectors. Men were more notably likely to be activists or pragmatists, and women, on the contrary, were found to be more likely to be reflectors or theorists.
An activist is an individual who learns by doing. Activists need to get their hands dirty. They have a receptive way of dealing with learning by brainstorming, problem solving, group discussion, puzzles, competitions, role playing, etc. Let's do a little case vignette. This one is titled See One, Do One, Teach One. So here Kyle is a PA student in his last year of training. He joins your team for a 1-month elective rotation in pediatric anesthesia. As an observer, he seems bored and disinterested in his own clinical rotation and is disconnected when asked to perform chart reviews, which is an important part of the job. Instead, he thrives in the operating room, and when asked to place lines and assist with intubation, he can move quickly between cases that are actually quite new to him. Activists learn best when they are involved in new experiences, problems, and opportunities, when they are thrown into the deep end, when they can work with others in problem-solving games and role-playing exercises, and when they are able to lead a group. Activists learn least when they are stuck listening to lectures or reading long explanations of a process, reading, writing, and thinking on their own, analyzing and interpreting a lot of data, and following precise instructions.
Now, let's take a look at the theorists. These learners get a kick at the chance to comprehend a hypothesis that drives the activity. They want models, ideas, and truths about a specific end goal in mind. Their choice of learning activities includes models, statistics, quotes, background information, and applications of theoretical concepts. Here's an example of a theorist in action. Ellen is an experienced nurse practitioner in a pediatric pain clinic, and she is learning about developing an APP-driven regional block program. The data provides evidence that Ellen's patients will benefit from a reduction in opioid consumption, as well as reduced pain and time to discharge and better quality of life in the immediate post-operative period. She's spending a lot of time preparing her team for the increase in clinical practice and is stressed because the administration is pressuring her to get the program rolling ASAP. She needs more time. Theorists learn best when they participate in an activity that is backed up by ideas and concepts that form a model system of theory. They are in a structured situation with a clear purpose, or when they have a chance to question and probe for evidence. And they are required to understand a complex situation so that they can come up with a solution. They learn least when in situations that emphasize emotions and feelings, when activities are unstructured or ambiguous, or when asked to act without knowing the principles or concepts involved.
Now on to pragmatists. Pragmatists are much more conceptual learners than theorists. These individuals have the capacity to perceive how to put the learning into practice in their present reality. Conceptual ideas and recreations are of constrained utility unless they can see an approach to put the concepts practically in their lives, experimenting with new ideas, speculations, and methods to check whether they work is their mode of action. They learn better through taking time to think about how to apply learning in reality case studies, problem solving, and discussion. So let's talk about our pragmatist. Hans is a nurse practitioner who works on the renal transplant team. He is well known for his clinical expertise and has been working at his institution for 25 years. He is familiar with cutting-edge surgical techniques in his specialty and has even trained in some of them. Yet he is more comfortable with the work he's been doing over the past several years as a standard of care. He's happy to take some of the new technology and applies it to his current clinical practice to see what sticks. Pragmatists will learn best when there is an obvious link between a topic and a current need, or they are shown techniques with clear practical advantages, or they can try things out with feedback from an expert. They can also copy an example or emulate a role model. Pragmatists learn least when there is no immediate practical benefit to the task that they are doing, when there is no clear guidelines on how to do it, and if it appears to be all theory.
And last but not least, let's talk about reflectors. Reflectors like to learn by watching and contemplating. They like paired discussions, questionnaires, timeouts, observational activities, feedback, and more feedback. In this case study, we're going to talk about Jan. She's a new graduate PA on the Pediatric Heart Failure Service. Early in her orientation period, when asked to initiate a clinic visit, she is obviously uncomfortable and feels unprepared. She's kind of been put up to the task and wasn't quite ready for it. She asks to shadow more frequently than other new hires and prefers to observe from the sidelines. When asked about her patient encounter, however, she actually has learned quite a bit. She can recite back key moments of the visit and can effectively articulate a plan. Reflectors will learn best when they are able to stand back and observe for a time period first, before jumping into a scenario when they are given time to investigate before commenting or acting on a scenario, when they are given an opportunity to review what has happened, and when they can do tasks without tight deadlines. They learn least when they are forced to take lead in a group, when they are doing things without preparation, and when they are rushed by deadlines.
And there you have it. We've now covered 4 learning styles as described by Honey and Mumford. Maybe we can bring this knowledge to our precepting experience in the hopes of being better teachers. The argument that they pose is that in order to be an effective learner, individuals must know about their learning styles and find ways to learn using these methods. Knowing your own learning style helps us make smarter decisions in adjusting the learning opportunities in an effort to improve learning skills and awareness. Thought: why do we need to learn how to learn? Well, this is simply just another tool in our toolbox, so to speak. We can use this knowledge of learning behaviors in our efforts to reach out to our selected, targeted audience. We should think about learning as a skill, one that we want to continue to improve upon, just like our PRs on our Peloton or that really hard yoga pose we could so easily do in our 20s that we've now decided we want to get back to. As is true with everything else, the results depend upon the process.
Here's a few key takeaways from this lecture. We prefer to learn in different ways. There is no one preferred learning style for everyone. Knowing our own style will help learning and teaching to be more effective. We are usually more than one type of learner, and as adults are capable of using more than one technique. The flexibility gives us the opportunity to focus on our strengths and weaknesses in an effort to try and make us more balanced. Teachers affect eternity. No one can tell us where their influence stops, and we'll stop there. Here are the resources we used while helping to prepare for this lecture series, and we'd like to say thank you. We hope you enjoyed this Learn Lecture 2-part series, and that you'll find it useful in your own clinical setting. Please feel free to reach out to us for other precepting ideas that you may want to share or that you may want to hear about in other lectures. The APP Precepting Committee is here for you. Please feel free to reach out to us at the email on this screen. Thank you for your time.